And we are launching a brand new medical series focusing on cancer screenings. There are still a lot of questions and there's much debate on who should get them and when, and we're going to sort it all out for you. This week in honor of Breast Cancer Awareness Month, we will focus on mammograms. You know, last year alone, nearly 200,000 women were diagnosed with breast cancer. Dr. David Samadi, a member of our Fox News Medical A-Team and the newly appointed Vice Chair of the Department of Urology at Mount Sinai, is joining us. Doctor, good to see you. First of all, the U.S. health officials are recommending now mammograms start when you turn 50, but all along we had heard much earlier than that. Why the controversy?
Well, this big controversy as a result of when you talk about screening, you have to consider the population. All these risks and benefits that we speak about in the population may be completely different than that in individual. So if you're watching this program, we're talking about you. So what is the risk of getting breast cancer in individuals? And that's the difference between the U.S. task force, where they look at the big population of hundreds or thousands of people as opposed to one individual. For example, we use mammograms or sonograms or breast exams. But if you're a high-risk patient, if you have a first-degree family, if you have over 20% chance of getting breast cancer, if you've been radiated between the age of 10 to 30, you're at a higher risk of getting breast cancer, and not only you need mammograms, but you also may need MRI. So for every individual is very different. At the end of the day, make sure you talk to your doctor about your risks, and that's really the big message out there.
Some women will say, particularly when you talk about the number of women who are diagnosed every year, that why not start earlier? What's the downside if I'm in my 40s and I get a mammogram?
Well, that's a discussion that the U.S. task force really brought up, meaning that they recommend mammogram between the age of 50 to 75. And they believe that the risk outweighs the benefit in the group between 40 to 50. You may find some cancers that are indolent, they're not aggressive, and the only thing that's going to do is to more surgeries, more anxiety and stress for the patients. Perhaps cost and finances has something to do with this. You have to literally screen about 800 women to find one cancer. And that adds more to the cost on this economy. So for the 799, we didn't really do a good job. For that one person that we found the cancer, we helped that person. What is the cost for that individual? To me as a doctor, there's no price for life.
Priceless if you save a life.
And that's really the purpose of screening. You're going to do a lot more just to find that individual, and that's a big discussion.
All right, you bring up a great point. Talk to your doctor, make them aware of any history you may have. The American Cancer Society recommendations, have they changed given what the task force is saying, and what do you recommend? None
of the doctors that I know of, they have changed. American Cancer Society recommends getting mammograms at the age of 40, once a year. And the clinical breast exam also along every year. The self-breast exam and the clinical breast exam is recommended for younger age because mammogram doesn't have a big role in that group. Since the breast tissue is a little dense, mammograms in 20 and 30s are not recommended. Ultimately, again, talk to your physician and make sure exactly what your risks are. I also always recommend to get a second and third opinion. We need to be a smart consumers, smart patients. Not every mass needs biopsy, not every biopsy needs surgery. Take that information and talk to your physician and do the right thing for yourself.
This is a great series. I'm really looking forward to it. Some of the other cancer screenings you'll discuss.
We're going to be talking about prostate cancer next week, since there's a similar discussion about that, continuing with colon cancer and perhaps skin cancer.
That's great. Dr. Samadi, thanks. Good to see you.
Thank you very much.
And if you're at home and you have any questions, comments, or suggestions, you can always contact Dr. Samadi at menshealth@foxnews.com. Next week, Dr. Samadi said he's going to talk more about cancer screening. The series will continue, and we'll discuss a similar controversy that regards prostate cancer and how it affects the men in our lives. And the doctor will be here to tell us what he recommends and clear up any questions you have, so go ahead and email him. Thanks so much, Doc.